Hello, Hopkinton, and welcome back to the Hopkinton Hangout Hour. Everybody here hopes that you have had a wonderful holiday season, and we welcome you back to some more new episodes. Today, Monday, January 4th, we are going to be talking with some officers from our police department about traffic. And in the second half of our show, we'll have Dr. Carol Kavanaugh and friends on to talk about the Health Track app, which is a new thing going on in our community. So stay tuned for that. But right now, I would like to welcome Chief Bennett, Lieutenant Porter, and Sergeant McNeil onto the show to talk about traffic in our community. Hello, gentlemen.
Hi, Jim. Happy New Year.
Thank you very much, and the same to you. Hope everything was nice and quiet over the holidays.
Okay.
Okay. All right. Well, I can hope, right? All right. So okay, first, let's start off with why do we have Lieutenant Porter and Sergeant McNeil here? How do they interface with traffic in our community?
Sure. Well, I'm really excited to talk about our programs here at the police department involving traffic. Anybody that's driven through town knows that we have a lot of cars that travel on our roadways during the day, and it can get very congested. We've conducted several surveys over the years, and most recently in 2019, we interviewed 445 people in a survey as we built our strategic plan, and over 400 times the word traffic came up in their responses. So it's certainly a big issue for the community. And in response, we're all really proud of what we built together over the years. And Sergeant McNeil is a traffic coordinator. We built, Lieutenant Porter and I built, and Chief Lee was part of it towards the end. We built a pretty comprehensive traffic response to both complaints and monitoring. And Sergeant McNeil leads that.
Okay. So my question is, I think everybody in town would understand if we said, oh, let's talk about the intersection of 135 and 85. And I do want to talk about that, but also I'm interested, what other areas of town or types of roads in town, where do you see a lot of concerns coming from?
Sure. The bulk of our complaints from the community come from the roads where the commuters are traveling through the town. So Front Street, Fruit Street, Ash Street, the connector roads that also bring the bigger neighborhoods towards the commuter routes. And
okay.
So we.
Okay, I know on Chestnut Street, it seems like every person from Holliston went down that street twice a day.
Absolutely. Now we have a nice light, a nice new light and turning lanes. That's one of the things is engineering can help improve traffic a lot. We use engineering, enforcement, and education primarily. Those are really the tools we have for traffic safety.
Mm-hmm. And when we talk about traffic safety, when we talk about concerns from the community, are we talking about speeding, or are we talking about going through stop signs, or is there anything else?
Sergeant McNeil, what are you hearing?
Well, good morning or afternoon.
Hello.
Most of the complaints that we get are speeders, of course. It's always going to happen. It's very difficult to stop everybody from speeding. But we do have other concerns, such as stop signs, as you said. But Main Street, right by Reserve Street, there's a painted box in the road, and a lot of people don't realize what that means. And that's for the school right there. The way the traffic pattern for the school is to come out Reserve Street and get onto Main Street, because you can't take a left-hand turn on Wood Street out of the parking lot. So people are just trying, in the morning and afternoon, are trying to get out of that street onto Main Street, either left or right, and people are blocking that intersection. So we had several complaints from drivers that it's a difficult intersection just by itself. But we worked with the DPW, and we had a sign moved, don't block the intersection. So it would be a little bit more readily available for drivers that are driving on Main Street to see, so they won't block the intersection. But that's just one example of what our program's doing.
Now, quick question, because I've always wondered this. Is that a ticketable offense, stopping on that block?
Yes, it is.
Okay, so that would be considered, is it a moving violation that's called?
I believe so.
Okay. All right. Okay. So you get a concern from the community. What happens?
Yeah, so they can express their concerns either using our website, www.hopkintonpd.org, and it's right on the front page, or they can simply call dispatch. And then the program will start. Sergeant McNeil, if you want to walk through what happens.
And you know,
Absolutely.
when you, I just want to ask, when you're encouraging the community, what types of things would you say to them when they're considering making a concern, making that call, or making that thing? What do you look for?
Sure. I mean, Jim, we've talked a lot about this. We're very much service driven, so we want to hear any complaints that the community might have. And even if it is a single car, the more information that they can give about that single car, then we don't have to launch this whole program. We can go out and target periods of the day, or maybe even contact the operator to say, your neighborhood's kind of tired of you driving through fast, and try to work it voluntarily, have the person voluntarily comply with the laws.
Okay.
Yeah, I've also noticed too, going back to the Reserve Street, Main Street intersection, is I think we received 2 complaints, but probably, I'm guessing 10 to 15, maybe even more, people want to complain, but they just don't bother. So
that is like such a good observation of that, because I have seen cars stopping on that thing, and I've always thought that never mind if it's a ticketable offense, it's just a polite thing to do, because you can't go anywhere anyways. And although, may I ask, is there a concern about there must have been sight lines done about cars coming out of there and being able to see traffic approaching?
Again, that's one of the problems of that intersection, is because there's a paved median on the right to prevent people from passing the stop cars to take that right onto Wood Street. So it is a difficult intersection. And again, I've worked with the DPW to at least move the sign so people can see it. They painted the box. I think they paint it every year to make it brighter.
Mm-hmm.
And it's just one of those difficult intersections that if we put a police officer there, then people usually pay attention and stop. So that's one way to help educate the public.
Yeah. Okay. So so the chief talked about how people can report a traffic safety concern. Once that happens, what happens after they report that?
So that it gets assigned to an officer, so they can again file a complaint online, like the chief said, through our website, or they could just call the station. So it'll be assigned an officer, and the officer can make contact with the person that complained to find out exactly what their concerns are. And then once they figure it out, so let's say if it's speeding, or let's just stick with speeding. It's just such a most of the complaints are speeding, so I'll walk you through that. So an officer will go down to the area. They'll speak to the person either on the phone or in person, and go to the area to find out exactly where the issue is. And then the officer, we have some folks that work under my direction that they set up this, we call it a speed spy. It's this black box that we can attach to a telephone pole, and it records vehicles traveling both directions, and it records their speed and the time of day they pass by. So we can get the highest hour, like people are speeding. So then we can deploy our units. Let's say between 12 and 1 o'clock in the afternoon, there's 400 cars that pass a certain area, and the highest speed recorded it was at 6 o'clock at night. So we can send somebody between 12 and 1, and then we can send somebody at 5 or 6 o'clock at night. And then if we leave that black box out for a week or so, we can see patterns. And sometimes the highest speeding car that drives by it may just be one car that drives by at the same time. So it makes our job a little bit easier in enforcing, instead of sending an officer down there for, you know, let's say between 8 and 9, where there is no speeders and there isn't a problem. So that helps that way.
So,
Let's take a look at some
you're
of the
building
data
a-
you get from that as you talk, Chief.
Yeah. So basically what we're doing is we're building a data-driven response. Based on the data, we'll decide which tools are best suit the situation.
So we're looking at now, are we looking at this live?
Yes.
Okay, so what we're looking at here is, I believe it's 158 Ash Street. And it was deployed between August 24th and September 2nd. And if you scroll down, so it says, so then just where it says vehicles analyzed, so between that time, 8,600 vehicles passed that location.
Oh.
So that's the speed limit in that area is 25. So we have it set up where underneath the 25 it says enforcement tolerance.
Yes.
So that would be people traveling 35 or above.
Okay. Gotcha.
So if you see, and then next to 25 would be the percent of the enforceable violations. So 11% of the vehicles, which below at the very bottom there on the left is 983. So there's out of almost 8,500, there was let's see, 983 violators. So which percentage wise, isn't crazy, but it's also shows that, there is a little bit of a problem. And then underneath the 11%, it has the 85th percentile. That's 35. So that's not what we're looking for. We're looking for the 85th percentile to be closer to 25.
Okay.
So I think we're going to talk about this later on, but the 85th percentile is what most posted speed limits are based from. So if we did a speed study on Ash Street, then that specific area, then that speed limit would go up from 25 to 35.
Okay. Now I got another. I'm not sure. You can talk about what this data, where this is coming from. Is this is the same? This is the same data, right?
Yeah, that's the same area, and basically it has the posted speed limit at 25, and then the enforcement tolerance is, again, is 10 miles an hour. So anything that's over 35 miles an hour. So again, it just gives us. So we give this to people that complain, and they, people like knowledge, and they like to understand what numbers that we can come up with, and we can get, if they said people are speeding, well, we can just show that even if we stop we give people the benefit of the doubt. We give them a 10 mile an hour over the speed limit, not a break, but if we give them the tolerance of 10 miles an hour of speed, and we're looking at cars that are doing 36 or more. Yeah, the problem's not that high. It's 11% of the vehicles driving by. But then we can also, I think you have another data sheet where it breaks down the numbers of how many cars drive by at certain hours and their speed.
Get that right here.
And it also, gives us the time of the day. So if you look on the far right, on the far left, it gives the days of the week.
Yep.
And at the very top, it gives the speed of the vehicles. And at the far right, it gives you the total number of vehicles that went by that specific day.
So on Sunday, 880 vehicles went by?
Yes.
And 198 of them were doing between 30 and 32.
Right. But if you keep scrolling, if you scroll to the right, you'll see a couple ones, a couple twos.
Yes.
So see, that's a problem. When
somebody went by at 55 miles an hour.
Right. Well, between 54 and 56.
Yep.
So we do have, what we're looking at is just a breakdown of the day. We do have, I don't know if it scrolls down, I think that just gives the rest of the time.
Okay.
So we do, I don't think it's pictured there, but we do have an hour breakdown.
Okay.
So we can look at those high speeders the high
Yep.
speed, and we could kind of break down to see if it's the same hour of the day. And
All right.
it also gives us, like I said before, it gives us an idea of the best times to do enforcement based upon
Okay.
those numbers that you just saw.
So, Sergeant, you got to tell me, did you get that guy doing 54 to 56 miles an hour? It was just one person who was doing that. Were you able to, like,
Sundays.
it's so cool using this data, you know what time of day, and maybe there's like maybe it's like Monday through Friday or something like that. Is there any result from that? Do we know?
Specifically, I honestly, I don't remember.
Okay.
But I can tell you this, that our numbers and our information that we get from that has helped us.
Mm-hmm. And you know what I like about that? Quite honestly, I think some people are like, oh yeah, it's just like data everywhere and stuff like that. But this is a really interesting use of that data. It's not as though, I mean, it's not as though it's like a blanket. We're going to go out there and we're going to ticket everybody so that so that the town gets an awareness that don't speed on this street. You're really getting a really good picture of what that traffic actually looks like. That's really impressive.
Yeah, Jim, we also collect all our data and we can map our accidents. So when we're looking at that road, we would run a report on the accidents on that road and look at them where they, the nature of them, were people transported, or were they, like on West Main Street, for people just bumping into each other because they have their phone. It's not a speed issue. It's
Right.
traveling too close to the car in front of you or distracted driving issue. So collecting these data points, we can craft a response.
Mm-hmm.
Some people that are upset about speeders in their road might be like, well, why aren't you out there stopping cars at 5 miles an hour over? Most people don't want to live in a community where people are getting tickets for 5 and 7 and 9 miles an hour over the speed limit. That would, that doesn't.
We've heard about those. Those are the police departments that fund their department through tickets.
Exactly.
Hey, we did get a question. Somebody was asking if this data that you collect, is that public data? Is it available somewhere, or is it internal?
No. So it's almost everything we do is public. And what I'm working to do is work on our website and to publish a lot more of this information as a resource for people to go out on this topic and many other topics. It's one of our community engagement aspects that we're working on.
Okay.
So you look forward to seeing it. Thanks for the question.
Excellent. So I want to be aware of our time. So I have a couple other questions for you. Why do some streets have speed limit signs and other streets don't?
Sure. So I can tell you that almost every speed limit sign that's up right now was here when I got here a long time ago. And the way the legend went is every time they would do a speed survey, the residents would become upset because the state would post the speed limit higher than it was believed to be. There's different speed laws, and we can enforce based on a speed limit sign or what's called the variable speed law. And I actually asked Sergeant McNeil to respond to the variable speed law. But from the historical perspective, generally the town found that it was counterproductive to bring the state in and study a road because it resulted in a higher speed, which was the exact opposite of what the community wanted.
Right.
Matt.
Jim,
Yeah, go ahead, please.
Yeah, I can add a few points here. So in order to get a road posted, you have to go through a speed study through the Department of Transportation. And then once their study is completed, they have to okay that with the Registry of Motor Vehicles. And then they come out, they do their study, which costs money. They figure out what the speeds, what the 85th percentile, that's what the speed limits are based on. So they'll sit on the side of the road and count cars or put a black box like we do, something like that. And then once they complete their study, again, they have to get it approved through the Registry of Motor Vehicles, and then they have to post the speed limit signs. And then they have to study it to make sure that the posted speed limits that they placed are appropriate. So it takes an awful lot of time. whatever, if there's a speed limit sign posted, then there's a speed law under Chapter 90, Section 18, which allows us to write citations for speeding under that Chapter 9018. Now, for the roads that are not posted, it's a different chapter. It's called Chapter 90, Section 17, and that's the statutory speeding law, which it basically gives it's 50 miles an hour, 40 miles an hour, 30 miles an hour, 20 miles an hour, based upon certain situations in the roads. So if anybody has any questions or wants to follow up, they can just go to massdot.org, and all that information is there right on the state's website.
Okay, that's really good to know. Now, this is an interesting question. When you're driving around, can you run your radar at the same time, or do you have to be parked and observing a spot?
So we can do it. Yes, we can. We can do that both ways. There's the radar units in our cruisers. There's a radar head in the front that faces forward, and there's also a radar head that faces in the back. So as we're driving down the road, there's different modes on our radar units. If I'm driving down the road and a car is coming at me, then I can turn my radar on and catch the speed of the car coming towards me. Same thing as if the car passes me and I'm like, well, I think that car's going pretty fast. I can also turn my radar in the back on and get the speed as it drives away.
Interesting. And do you see a lot of cars where, like, you see a car approaching on the road and all of a sudden they really slow down? Do you see that a lot?
Oh, absolutely. And now with the new headlights, it's even more prominent.
What do you think about those new headlights?
It's my personal opinion. I think it's terrible. A lot of them, you think you're driving and people have their high beams on and you flash them, and then they hit you with the high beams. I'm not sure what the manufacturers are doing with those headlights, but they are awful bright.
I'm surprised that they can do that. There should be some kind of standards, because wow, they're incredible.
Yeah.
All right, we got a few minutes left. Can we talk for a minute about school? What happens as the town is getting ready to go back to school and everybody's thinking about school buses, and there's kids all over the place now? Do you guys do anything special for opening of school?
Lieutenant Porter, you're in charge of the school resource officers, and if you could speak to that.
Sure, Jim. How you doing this afternoon?
Hi.
So about 2 weeks prior to the start of every school year, we sit down and we meet with our school resource officers to go over the previous year's complaints from either parents or the bus coordinator and so forth, and try to find out if we had any problem bus areas or problem streets. Leading up to the start of school, we start going over a roll call, the various aspects and the locations that we've had problems with in the past. And once at least the first week of school, what we do is we put on extra shifts, which are marked cars or unmarked cars. And they're tasked with either setting up in the school zone to educate the public, schools back in session, to slow it down, or to follow school buses around town to make sure people are stopping from the buses stop at to pick up children and so forth. We also make sure that we get through social media, we get our messages out regarding the school openings, and we always try to get feedback from the community as to what they need or what they're looking for when school's opening.
Is there a time period when school has first opened that things are more difficult? I mean, just the thought of, kids on the street and cars driving around can be scary. I'm just wondering, in our community, how are we doing? Are things pretty calm, or is it nerve-wracking?
The start of school is always nerve-wracking. You have children going from one school to a different, whether it's middle school to high school or Elmwood to Hopkins. So there's always a different traffic pattern. Parents are worried about making sure their children are on time, because the kids can't be late for school, even on that first day, God forbid. So they're queuing up much earlier, which causes traffic congestion along Hayden Road, which we've tried to alleviate with different traffic patterns in and out of the schools. You have your summer commuters who are used to leaving at a certain time and making sure they get to work right on time with a minute to spare. Now we're with school openings and bus stops and people coming in and out of the schools, 10, 15 minutes could be added on. So there's frustration from the commuters. So that's why we try to get out there early and make everybody aware that it's time to buckle back down. School's back in session. Start watching for the, expect delays, give yourself extra time to get in and around.
Right. And when a school year is being prepared and at some point somebody somewhere is designing the bus routes, I assume they share that information with you?
Yeah, we have a school safety task force that meets monthly, and we go over bus routes there, as well as our 2 SROs are always consulted on changes in bus locations. We did it for most recently with Legacy Farms. We identified a really big issue up on Legacy Farms, safety issue with kids and bus stops up there. So they were intricate a part of that. They did some studies. They worked with the developer up there as well as the school department in the town and came up to different solutions to make that more safe for everybody.
And during the school year, is there, I don't know, if the dispatchers, like, do you guys have the bus route plans so that you can refer to that if a call comes in, you'll know which bus is where, or where does that information reside after it's created for you to use during the year?
Yep, so all the bus routes are shared with the SROs who then share it back with the department. So we know where all the bus routes are. We have locations of what bus stops are and the location of the bus stops, northbound, eastbound, where they get dropped off and so forth.
Great. All right, so this has been really good. This has been a really interesting conversation. We only have a few minutes left, but I did want to ask generally, if any of you have an answer, what's new in 2021 for traffic?
Sure, I can start with that. Give Lieutenant Porter a huge shout out. He just worked through a program where we installed e-ticketing into the cars. So instead of handwriting tickets at roadside, the information gets entered and the citations get generated and printed right inside the car. Lieutenant Porter brought those into the cars at no expense to the department, working through the state. Good job on that. We're looking to get an officer certified in commercial vehicle enforcement. Sergeant McNeil's work has identified an officer we think would be fit in that role, Officer Ryan Pacelli, and we just got to get him out to the school. And one of the things that we're going to be bringing back that we haven't done in a little while is crosswalk enforcement, using plainclothes people to simulate, to walk the crosswalks and to educate the public on it. We know that there's been a lot of concern, especially downtown, about the crosswalks. We've had some people that were in there, and we're going to be bringing those back. So that person walking by might actually be a plainclothes officer or a dispatcher or a volunteer citizen. So let's be careful with the people walking around. They don't have much protection.
So when someone's great comment. When someone's in the crosswalk, right, and you notice them, and you're kind of close as you're driving by. Is there any way to not feel guilty if you don't have time to slow down and let them go? I mean, sometimes they're in the crosswalk and they're waving at you.
You should feel guilty.
Okay, I guess if I do, I'm going a little bit too fast, I guess is the answer, I guess.
That's right.
All right. Well, gentlemen, thank you all so much for spending this time. And I would like to own up to the fact that in my conversations with Chief Bennett, he mentioned that traffic would be good to discuss, and it really has been. And I think that there is even more. So as well as all the other things that you are all doing, I'm so excited that you not only you here for us, but you're here for us sharing what you do to the community. So for the community. Thank you very much for being here.
Thank you, Jim. Happy New Year.
All right.
And pleasure,
Chief,
Jim.
thank you. Thank you, Sergeant McNeil and Lieutenant Porter. And Chief, I'll see you at the end of the month for the Ask the Chief segment.
That's right. I'll see you then.
All right. Take care.
Bye now.
Okay. That was really interesting. In fact, the chief is always talking about very interesting things that's going on in that department. So I look forward to bringing more of them. And right now, another very interesting couple of departments here in collaboration. We have the Board of Health and we have the school department here to talk about what has been called the infamous Health Track app. And I'm not exactly sure why, but I'm really interested to explore what's happening with that. So Sean McAuliffe, Dr. Kavanaugh, and Kathy Bain, welcome to the show.
Thank you for having us.
All right, let's start off. If anybody doesn't know, please, what is the Health Track app?
So, as most people are familiar with, if they're still commuting to work or going to the doctor's office, there's a universal requirement across all workplace sectors except for schools that requires people to attest on a daily basis that they do not have any symptoms, that they haven't had any exposures, that they haven't traveled outside of the state, and that they do not have any symptoms. This, we've been using, or we had implemented this attestation process back in the beginning of March in the municipal offices, before actually the Commonwealth instituted the requirement. And we've had, I think now we've had a total of 3 issues where someone in the municipal, under municipal employment has tested positive, but it's been caught by the app. So there hasn't been any workplace exposure. And the thought was that implementing a similar procedure in the schools would help us identify, or first off, it would help prevent people who have had either an exposure in the home or at a location outside of the home from sending them to school ill. It would prevent, say, someone who is awaiting results from sending someone into the school again before the results were in, because at the end of the day, what we're trying to do, and if we're successful, we're looking to keep illness from getting into the school system. And if we're doing that, we have a much better chance at keeping the schools open and continuing, the streak that we are on.
So the Health Track app, was it active for the municipal side before the educational side?
No, we had implemented our own
Okay.
app beforehand.
I see. And that's the app that caught 3 instances. Now, Sean, I'd like, if you could, to talk about that for a minute, because I think that's very interesting, because the app is nothing but asking you some questions,
Right.
And some people might say, well, I already know what the thing is. I'm social distancing and I'm wearing masks and I'm not going anywhere. But that app just caught 3 people that caught in the way that prevented illness from spreading in there. How does that work?
So in the municipal workplace, what this app does, and it is simple. And one of the issues right now is that we're all fatigued, probably experiencing some sense of depression. We're struggling with executive decisions, and when you start factoring in, oh my God, got to get my kids up and ready for school, and if we even just keep the school out of it, if I've got to get myself to work, you're making all these decisions in the morning. And then if you have this app that simply asks, is anybody in the house currently, or have they resulted positive for COVID? Has anybody been recommended to go get tested for COVID? Has anybody traveled to a high-risk community, outside of Massachusetts, or a high-risk area outside of Massachusetts? Or are you experiencing any of these symptoms? It gives you that pause to sit there and go, well, Me, no, but my wife, had a possible exposure at work and has been recommended to go in for testing. So you're gonna, if you answer honestly, you'll sit there and say, oh, well, my wife is, and you'll check no, and then you'll get a notice saying you shouldn't go to work until your wife's results have come in. It's to get people thinking and to help assist people with the decision-making process. And it's a constant educational kind of reminder of what the symptoms we're looking for, what these exposures are. And in the municipal sector, we've had individuals where they've been completely asymptomatic, but at home that evening, they've realized that I couldn't smell a candle, I couldn't smell food, and they've gone out, got tested that evening, resulted positive, and we didn't end up having an exposure in the workplace. And we're looking to take that same success and apply it here in the school setting, because here we have a lot more potential exposure points, and we're just trying to again minimize the risk to both the students, the staff, and the teachers in the school system.
Right. So Carol, in the school system, who is filling out the attestation? And welcome.
Well, thank you. So in the school system, the teachers, all of the faculty and staff did get an email so that they could enroll in the Health Track app. And so too did all of the families so that they could enroll their children. Hopefully in the morning, a mom who has a couple of kids will go through and answer those questions just quickly. And, as Sean just said, hopefully that will kind of jar that person's thinking to make them say, he is kind of sniffly today, now that I'm thinking about it. And, it brings to those kinds of questions into your mind of, why is that? You know what I mean? Sometimes, as Sean was just saying, you're in such a hurry in the morning to get yourself off to work, to get the kids out to school, to get the lunches packed, or whatever it is that you're doing. You don't really stop and take that time to think about what you're doing. So hopefully the app will get us to that place where people are thinking, let me take a real quick look at my child and see what's going on with that kiddo this morning. But as Kathy will share with you, in the schools, even if someone fills out the app, we still want parents to give our nurses a call, because sometimes it's good for parents to have that conversation with the school nurse. It's good for the school nurse to know the mom's making a decision not to send that kid to school, and certainly Kathy can talk much more articulately to that point.
Hi, Kathy.
Hi. Just to take sort of a step backwards, is just to kind of clarify a little bit in terms of the school district. We have asked people in the honor system to do that self check-in every morning, whether that's staff or parents of students. So it's definitely something we've been doing. An app is definitely an option. We've been doing kind of on the honor system, and we have a Google Doc that we ask parents to fill out, and it asks those same questions that Health Track will be asking. So a Health Track will be another tool to gather data with. We definitely, when you think about it, there are a lot of reasons for absence. Yes, COVID's a very important one, but in terms of data collection, there are a lot of other reasons that kids are absent, from other illnesses, to injuries, to surgery or bereavement, or any other reason. So it's important for us to know those things and to track all the data for any kind of COVID or COVID-like absence within the district as well, to keep our numbers kind of so that we're all on the same page, if that makes sense. And we like to have conversations with the families to kind of gather that data. Where was an exposure? Wasn't an exposure? Well, did you travel? So we have clarity as well.
Right. And does our Health Track app, does that go to the Board of Health, Sean? Or does it also go to the school system? Where does it go?
Both. No, go ahead, Sean. Both.
So it goes to both. And what we do each morning now is we go through the data to see if we've identified any new people that hadn't been on our watch list, and it gives us an opportunity to start those conversations. And this morning alone, there were at least 2 individuals that I hadn't seen in the system. They hadn't shown up in the Maven database. that tracks COVID positive people. And in this, one of the instances, a parent recorded that their child was symptomatic, but it prompted those conversations, and it kept individuals from coming into school that in both cases there was an exposure that we caught, and actually in both we likely caught 2 cases of illness and prevented them from going into the school, which then prevents us from having to quarantine portions of the classroom and possibly additional teachers, et cetera. Mm-hmm. So it's and even last week when parents were just playing with the app, it helped identify a couple exposures that we were able to jump on before the documentation had made it into the state's databases. So
so this is something I'm really interested in. So there was a story, a friend of a friend had a child who was going to visit their cousin, and the cousin's mother was talking to the first person's father and said, oh, you know what? He's got just like one symptom, but I'm sure it's going to be fine. And the guy said, well, what is the symptom? And she said, well, he lost his sense of smell. And we're like, all right, you know what? If anything screams COVID, it's losing your sense of smell. But there are so many other symptoms, and so many people, I don't know. Actually, I don't know. I mean, are people saying, well, you know what? It's probably just a stomach bug or, something else, and I don't need to worry about that. How do you address that concept?
Well, if someone's got a stomach bug, do you want them in the class?
True. Yeah.
This is this is one of the challenges here is that, we don't want people with the flu coming into school. We don't want people with the flu virus coming into the school. We don't want people with, staph infections or strep infections. So in theory, this should also help drive down the overall rate of illness in the school system. And it certainly has within the municipal offices. We have it might be the lowest rate of absenteeism and the highest level of health, I can't say in recorded times. I don't know how long it's been, but I know that it stands out to HR that they have never, the HR staff that are present have never seen the rate of absenteeism and the rate of illness as low as it is right now.
I'm just pausing because that's really interesting.
Too.
Yeah,
what, Kathy, say again?
Well, that hand washing has helped too.
Yes.
You can't turn around without bumping into a sanitation station.
Not.
I know. Now, I don't know, so I'm asking. Is there a concern that people will be thinking, if I check this off, I got to go into quarantine, I got to get a test, and it's going to be 2 to 6 days before my results come back, and that's going to be hard for me.
I mean, at the end of the day, like I would first off just hope that someone isn't going to put, their community, their children's classroom or their workplace at risk because they don't want to quarantine. What they can do is they can speak to nursing professionals like Catherine, her team, Casey and I, to help them make better decisions. And again, at the end of the day, what we're looking to do is if we can reduce the risk of illness in the community, we have a much better chance at keeping the school, hybrid, not having it, avoiding closures. And and the further we depress the rate of illness in the community, um, just the less risk we have, the greater continuity we should see in our day-to-day operations. So if we're seeing a reduction in the number of case contacts that are identified or exposures in the school and or workplace, everybody should just experience a little bit less strife and just and like I said, it's just a greater continuity. You're not going to have to keep on making adjustments for your kids who are now fully remote or now, yeah. So we're just looking to establish an improved rate of health in the community. And we believe that this is a tool that will help do that.
Okay. Now, before we move on, Cal, I don't know if you want to make a comment to that.
Yeah, I guess, I want to go back to Sean's comment that, we talk about people who are coming into school and really trying to keep unwell people out of school. And we know that in previous years, if you had that like little bit of a sniffle or a cough, you could take a little cough suppressant and come right to school and probably endure the entire school day and, get your homework. Maybe you only last till noontime or whatever and head home. I mean, I really do think it's probably a little bit of a sacrifice for people to say, yeah, I'm going to keep my child home and kind of see what happens with this little cough or sniffle. But we really need for people to do that. When we were formulating a reentry plan, we kept saying, this really depends on COVID not coming into our building. And the only way that it doesn't come in is when you start to recognize that things aren't quite right, you keep your child at home. And we appreciate that. I mean, certainly this year more so than ever. Before you may have transmitted the common cold to a peer, but now you could be doing, a whole lot more damage than you used to be able to, just because of what this virus is and how it's transmitted.
So I'm curious now, Kathy or Sean. Sean mentioned that there were 3 cases that were caught by this app. Have there been any instances of cases that were not caught by this app because maybe somebody was devaluing their symptoms or something?
So first, the use of this app that I referred to was related to the use of the app through the greater municipality to start, because we've really just rolled this out today.
I see.
But again, this morning I had a conversation with an individual that had gone in for testing that hadn't resulted. They felt that they were unlikely to test positive, but had taken a step back and said, I'm not going to send, I was denied, they got a red check when they completed their attestation. And we had a follow-up with them. And then in that time, they got a call from their physician that they had resulted positive. And this is the stuff where it's giving that, it's creating that pause or that separation, and just that moment to start thinking things through. And then, in hindsight, the individual said, oh, if I hadn't have stopped and thought about this and got the red check, then, I would have had no problems, basically sending my child to school. But then now in hindsight, they realized, what repercussions that would have had. And again, there were, it was an exposure that in the recent past that had now when they filled out the app, identified flu-like symptoms, and we're fairly confident when they go back and get retested over the next couple of days, there's going to be at least one, if not two, resulting positive. And it's this, it's again, it's this check. It's this, just a reminder that, you know, that these are the symptoms we want you to focus on. These are the interactions in the community or in the household that we want you to focus on. And if people are participating, if people are answering positive, or if they're answering honestly, we should be able to keep illness out of the household.
How is the rollout going amongst the town side and the educational side? Is everybody loving this thing?
So I can talk to the nurse piece of it. We are actually going to meet with Sean and Casey on Wednesday to actually get some more training. We've looked at the app, but in terms of things that we need to learn about the app, it's, you know, definitely a tool that we'll access throughout our day, one of many, but we are interested in learning more on Wednesday. So we're still at the beginning piece of it.
Okay.
And
Like,
I was going to say, I'll be the first to admit that on our end, the rollout hasn't been as smooth as it should have been and could have been. But you know, I think we're in a better spot. And, you know, the numbers suggest that, you know, parents are subscribing, they're starting to use it. A greater percentage of teachers are using it. And, you know, it's, if nothing else, it's starting this conversation, and people maybe just to, again, reassess how they go about their morning routine. And then Carol.
No, and that is why I laugh, because I really feel like we are still in the incipient stages.
Right.
You know what I mean? Like, we are really just at the beginning. So when you say, how's it going? We're not sure yet, you know, but I think we are in a much better place than we were a few weeks ago, because as Sean said, we have parents and teachers now signing up, and I think we're getting it underway.
And then, like, I think in general in the community, we were in a different place. You know, when we started looking at, you know, the utilization of an app, you know, back towards the summer, you know, we were seeing maybe a case, 2 cases. You know, if we had 4 cases in a week, that was a big to do. And, you know, it was everything was more manageable back then. You know, when you look right now, we've had 295 cases since September 21st. We've had 33 cases over the last week. We've had exposures in different environments that are causing us to have to put people into quarantine. And in an exercise that I, you know, had to undertake last night, what would have taken me otherwise 3 to 4 hours to complete, I was able to send out emails, switch people's their clearance or authorization to attend school that day. Basically change it from you're cleared to you have to monitor yourself at home. I was able to do that in a half an hour. And this is, I mean, we're looking for these tools that can basically reduce our, you know, our work days from, you know, a 10, let's say a 9 to 12 to something a little more manageable. And, you know, I believe that this is going to be a tool that helps us all get back to and find a little more normalcy.
And what are the groups of people who are contained within this app? Oh, you're muted. Okay. All right. So maybe Kathy or Cal could talk about the school side. What groups in the school side are contained within reporting to this app?
Our entire faculty, all school personnel, Carol, correct me if I'm wrong.
No, that's correct.
And all students.
Okay. And
Again,
the-
it's an option,
yeah, it's an option.
option.
Okay. So
So
they
using the
don't have,
option, we are encouraging it. Sean
okay.
is encouraging it. It's one of many tools we're using.
Okay. Are any of the students like self-reporting? Obviously, the lowest grades would be the parents reporting for them. But the parents report for their students through all grades?
Sean, do you want to answer that?
So we have parents who have asked us to set up separate accounts for their high school students.
Mhm.
Or, we want to obviously withhold that, say, the higher level of decision making to the older students, and we want to give the parents the option to help make that decision if they, as long as they feel that their child is old enough and mature enough to handle the reporting, that's fine. And then I would argue that no one really knows their body more than the individual.
Yeah. So Sean, outside of the school system, what other groups are swept up in this app?
So every workplace sector is required to complete an attestation each morning. And if you're not in compliance with the governor's orders. It's so most people, and what's interesting in town is you've got a lot of people that have the ability and the flexibility to work from home, so they're not having to report every day. But then when they go to the doctor's office or certain other locations,
Mhm.
they have to fill out a report. They get their temperature taken, they complete the attestation that they haven't had any exposure, that are COVID positive themselves. They don't have anybody with COVID in the household, that they haven't traveled. So everybody is supposed to be doing it, and it just wasn't required in the school system.
I see. Okay. Somebody lives in Hopkinton and they work in Framingham. They fill out an attestation. Does it go to their workplace, or do you also see it for residents?
No, in private workplaces, I don't see that at all.
Okay.
What I do get is if you are not complying with the workplace sector requirements, the Department of Labor, the Attorney General's office, and the Health Department, as an agent of those two, are supposed to go in and investigate. And if we find that you're not doing it, you're subject to the fining structure established by the governor. So it could be, I think it's attestation, I think falls within $300 per person per day. So if you got a workplace of 1,000
Yeah.
people, that could be considerable fine. And so it's the honor system that everybody's following it.
Yeah.
And here in the school system, it's this, it's what do you, if we all want the school to succeed, we want our children to have a safe, learning environment. We want there to be continuity in attending school, and as parents to know that my children are going to be able to go to school and I'm not going to have to change my schedule because they've been put remote for any variety of reasons. And
Okay.
this app should help do that.
Okay.
I'll just jump on that.
Go ahead, Cal. We got 20 seconds. Go.
Yeah, only because when you were talking, Sean, about being able to flip that switch and keeping students out, like if you go back to the time when we had to close for 2 days, an Orange Day and a Green Day district-wide, hopefully we will be able to eliminate issues like that.
Perfect. Hey, thank you all for your work. Thank you so much for what you do for our community. Thanks to our viewers for watching the Hangout Hour. Tune in on Wednesday when Dr. Kavanaugh will be back talking about what's happening in school systems next. Take care, everybody.
Thank you.
Bye.
Bye-bye.